we are doing Q&A tonight. And so all of you guys that pop on have an opportunity to ask me anything. And to start us out, I'm going to take some questions from people that have already submitted them online. So I'm just going to start taking questions. And if you guys have any questions, throw them out there and I will get to them. Thank you everybody for coming on. So I have a whole list of things here. Let's start with, hi everybody, we're doing a Q&A tonight. So if you have questions, ask them. I'm going to start with some ones that were already submitted. So first question, I have hard water. Is using a water softener safe? So I think the answer to this is really dependent on what kind of water softener you have. Usually they're ion exchange, because the difference between hard and soft water is that hard water has a lot more minerals like calcium and magnesium, and soft water generally doesn't have as many minerals. So people tend to want to soften their water because there's benefits to not having as hard of water in your system, in your house's system is what I mean. So if you have harder water, which means that your water has more minerals in it, it means that it can affect the pipes in a negative way. It can be more corrosive. It can build up on your silverware. It can build up in sinks and showers. And it can be hard on like skin and hair. And so that's why a lot of people will, they will soften their water. But generally you have to have a system installed. And when you are softening hard water, what you end up doing is you end up taking out some of the mineral content, which one thing that we love about water is that it obviously hydrates us, but it also is a really great source of minerals. And so whenever we are taking minerals out of water, we have to think, okay, well, where are we going to get these minerals elsewhere in our diet, or are we going to re-add them to the water? And so, if you're someone that eats a really, really high veggie diet, then most likely you're getting a lot of good minerals every day. But a lot of us, one of the main sources of minerals is the water intake that we have. So I would probably test your water before you do a water softener. And there's lots of great online resources that will talk you through like the risks and benefits of having hard or soft water. So I would do a little bit of research because it's kind of a personal decision. Some people live in a hard water area and they don't soften their water. Some people do. And if you don't choose to soften your water for the whole house, you can do all of those different types of shower filters. You can buy a water filter to filter anything that you don't want in your water. And every spot of the country is different with what their water tends to be like. So check the water in your area. And also, it's always a good thing, you guys, to check out what kind of toxins are in the water in your area anyways. Because some areas fluoridate the water, some areas have chlorine, some areas are really hard or really soft. And so like all of us ladies that have lived anywhere, we know this because we feel it immediately in our hair, and our hair texture changes depending on hard or soft water. But water that you're using in your house is going to affect not only your hair, but it's going to affect your health because you're going to absorb it, whether you're taking a shower or whether you're drinking it. So I'm a big fan of making sure that you know what's in your water and getting the appropriate water filter. And then, whether you choose to soften your water or not is your choice. But generally softening water is fine from what I know about it. I used to live in New Hampshire and we softened our water. And it was totally fine. Let's see. Let's take one from Instagram. Is it important to take K2 with D3? So generally, yes. We tend to get K2 from different plant sources, specifically vegetables. And a lot of people don't eat enough vegetables, so some people can be K2 deficient. which is a problem, or just vitamin K deficient in general, because there's K1 and K2. But the idea behind K and D going together is that when you take vitamin D, it can change the amount of calcium that you absorb. And so the idea behind K2 is that it essentially helps to protect your cardiovascular system and gets the vitamin D to where it really needs to go. So when I'm doing high dose vitamin D, I generally will do it with K2, but in the patients that I have to do vitamin D with, they generally have other deficiencies. And so in those types of patients, I'm always thinking, okay, how are we going to improve absorption of everything overall? And we know that K2 and vitamin D help each other out. So most of the people that I work with, I do K2 alongside D, but it's not always the case, especially if it's like a very low dose. So really good question. Okay, if anybody wants to chime in, feel free. I'm going to take another one from what's been submitted already. Another water question. Do you recommend drinking natural mineral water every day? So the answer to this is really going back to like, what kind of water should you drink? Everyone should drink water, half your body weight in ounces per day. That's really important, just to drink enough. Natural mineral water, I mean, I don't really know what you mean by natural. Minerals are in water. Mineral water is water that has minerals added to it more than what naturally occur, or it comes from like a spring source where there's a lot of minerals coming from that water source. So mineral water in general is really good. Some people have what's called reverse osmosis water filter systems, which RO water is really great for taking out a lot of toxins and chemicals, but it also filters out everything, including the minerals. And when we don't drink minerals with water, we sometimes have a hard time getting that water to fully hydrate us and soak into our cells and have us hold on to the water that we need to keep us hydrated. And so if you have a RO water filter, I would highly recommend supplementing with minerals, especially if you notice that you're peeing a lot more than you should be. But I'm a big fan of just getting water filters that filter out almost everything possible, whether this is like a whole home water filtration system, or whether this is something that you have on your countertop. There's positives and negatives to almost all types of water filtration. When I was doing my research, I wanted a unit that was portable because we don't own the place that we live. And I wanted something that was going to be really easy and very non-toxic. I'm very anti-plastic. If you've been following me at all, I hate plastic. And so when I picked my water filtration system, I knew that I wanted fluoride out of the water, and I knew that I wanted chlorine. And I knew that whatever water filtration system is going to take those two bad boys out is going to take out pretty much everything else. So I settled on a Berkey water filter, which you guys can probably go to my page and scroll back a little bit and see what the Berkey filter looks like. It's a really nice, big stainless steel contraption that has an upper and lower chamber, and I have two types of filters in there. One type of filter specifically does fluoride removal, which is awesome because very, very few water filters actually remove fluoride. And then the other filters in the system filter out all of the different chemicals. And when you're buying a water filter, you should get the definitive list of what it filters out. And you know, whether you're on city water or well water, a good water filter is going to be really key. And the one that I have, the Berkey, it sits on my countertop. I have a big pitcher, a glass pitcher that I put in the sink, and I fill up maybe about 4 times, and I pour in the top, and then the whole thing filters. So it works really well. And happy to answer any more questions about that if you guys have them. But probably a question in here is about alkaline water. because I get that a lot. Alkaline water is awesome. It really helps against inflammation and chronic disease. It's becoming way more readily available than it ever has been. And so if you drink alkaline water, I'm a big fan. Just make sure that it's got all the minerals in it too. That's not just alkaline water, because you want the whole package with water. For those of you that are just joining, we're doing a purely Q&A night. So if you have questions about anything, I'm answering them. Next question. Are cold showers / baths beneficial against inflammation? So this is a very old hydrotherapy concept, which is cold water immersion. In naturopathic medicine, a lot of our founders were really, really big into something called hydrotherapy, which is the use of water for healing. There's lots of different hydrotherapy types of applications that you can do. And one of them is all sorts of different types of water immersion, whether it's cold towels applied to the body, whether it's just like waist down parts of the body, whether it's full on immersion. There have actually been a lot of studies that show that doing cold water immersion of all types is really beneficial for lowering inflammation, improving the immune system, decreasing cytokine response or cytokine levels. But the interesting thing about cold showers, they're especially really good for men and testosterone. And I really think that they help improve resilience overall. I know that some of the more Arctic cultures will do cold water immersion because they feel like it helps them be warmer actually in their environment. Because what happens when you put yourself in cold is that your body then has to do its thing to actually warm you up. So cold baths and showers and immersions or jumping in the lake can actually help to make you feel more warm because your body has to work to do that. The other benefit of the cold showers is that whenever you're going from a warmer environment to a cold environment, you're creating a big pump of blood flow. And so when you are going from warm environment, your vessels are more dilated. When you're going to cold, they're constricted. And so we're getting this pumping action of warm to cold. But especially if you repeat this multiple times, then we're really pulsing the blood flow and the lymph around, which is hugely beneficial for health. So I often recommend something called contrast hydrotherapy, which is when you do 3 cycles of 3 minutes hot, 30-second cold, always ending on cold. And I've done this with like injuries, myself and other people. I've done this to help draw fevers down. You can do this on any part of the body to help improve healing, whether you have like tennis elbow or you have, a difficulty with healing a wound on your foot. You can do that with hot and cold towels. Really, really helpful. So I love hydrotherapy in general. So if you guys ever have the opportunity to, jump in a cold lake and then jump in a hot tub, do it. It's so good for you. Let's take another one from over here. Do you recommend dry skin brushing? I do. I think it's really helpful, especially if someone has an issue with their lymph flow. So your lymph is essentially this space between your tissues and your blood where your immune system lives, and it's kind of like your body is collecting waste and moving it around. It's where your immune system can move around, but it's also like helping you to have the right amount of water balance in the body. And so some people that have like a lot of inflammation and chronic swelling, problems with their immune system, problems with hormones can really throw off the lymph flow. And so dry skin brushing is something where you take a natural boar bristle brush, say that 5 times fast, and you brush always towards the heart, the heart. It's opposite on the camera. So you brush 3 times So like if I was brushing my arm, I would do it 3 times on all sides. And then you go up from distal to your heart. And most people start at their feet and work up their body. And you always do it towards the heart, because right up here is where you have a big dump of lymph back into your circulation. So that's why you do it up towards the heart. You also have a big lymph collector kind of down in here area, right around where your ribs are. So the direction and the amount of pressure is actually really important. It should be kind of like you're petting your dog. It shouldn't be a lot of pressure, because lymph is very subtle. The movement of lymph is very subtle. So we don't want to have a lot of pressure. Otherwise, we're going to actually have an issue, supporting the lymph. I would say that some people notice a huge difference with dry skin brushing, and some people don't. So I always recommend that people do a trial, like a good 30-day trial of dry skin brushing with the correct brush in the correct way before their showers every day, and see how it improves. But I meet a lot of people that have issues with lymph stagnation, and the reason why is because the hormones and the lymph are really connected. And so if somebody's not doing well with hormones, sometimes it's a lymph issue and vice versa. So I'm often saying like you should dry skin brush, but it's not something that comes up a lot except in treatment plans. So I'm glad that you asked this. Throw them out if you guys have them. Let's see. How do you feel about the blood type diet? You can probably tell by the smile on my face, I don't think very highly of it. The blood type diet is this idea that because of your blood type, you're supposed to be eating different foods. And I have seen people do this diet and feel amazing. I've seen people do this diet and not do amazing. I've had mentors in the past where that's where they start with clients, and I've had people, tell me if they did the diet for their blood type, they probably would feel really ill. I've read parts of the book. If you read the book, I think it will become really clear that it's not very scientifically based. There's really no evidence that your blood type dictates what foods you should eat. It's funny because I've had other naturopaths way back in my journey recommend that I eat for my blood type, and I'm the type of person that needs a really good amount of protein. It's just how I'm wired. I've figured out my diet and I feel good having protein really consistently, and it helps me maintain the physique that I want. It helps me maintain the pace of life that I want. And if I were to do a type A diet, because I'm A positive for my blood type, if I were to do an A type diet, A type diets are generally vegetarian. And I have been vegetarian vegan in my life before for a good amount of time. It was at least 6 months, maybe a little bit more. And I was probably the sickest I'd ever been in my life. So take that story with what you will. But regardless of my experience with it, it's not scientifically based. And so I like to make sure that things work scientifically, and then see if they work anecdotally, see if they work with patients. But two of those things have to line up. They both have to line up for me to be into it. So no, I do not recommend. But you guys would be shocked at how often I get that question. Like, I'm so glad this person asked it, because it's so common. I get this question all the time. Let's see. Water. Let's go over here. Any thoughts on helping with the manic jitteriness I feel when taking B12 with folinic acid? So this is a good question going off of my live that I did last week. I did a video last week on B vitamins and some considerations that you should keep in mind when you are choosing to supplement with B vitamins. We talked about the forms, what B vitamins are for, and generally the reason why people do better or worse on B vitamins is because they have certain genetics that either help them out or don't. They have different genetic pathways that are either stopped up, blocked, or not. And so generally if someone is jittery on either on either like methylfolate or folinic acid, I guess, though rarely do I see that, or B12, it generally means that they either took too high of a dose or that they have some pathways that are blocked and aren't cycling these things through so that they can use that nutrient. Or the form is wrong through their specific genetics in terms of what MTHFR gene they have, in terms of what COMT gene they have, in terms of what their detox pathways are like. So really, to answer that, you have to do some playing around with the types of B vitamins that you're taking. And sometimes timing and what's going on in your life matters. But I would definitely I'm a big fan of tests, you guys know that. I would probably just do a genetic test and see, what your genetic pathways tend to favor. If you guys want to learn more about this, a really nice, approachable way to learn about genetics and, supplements and what to do with yourself is Ben Lynch's book, Dirty Genes. Ben Lynch is a colleague of mine. We went to the same school, though he's much older than me. We didn't go to the same class. But he's a Bastyr grad like me, naturopathic doctor, and he really wrote the book on MTHFR and has done a lot of the pioneering work on, getting methylfolate some press. And I'm really thankful for his work, and I've learned a lot from him. I used to go to his seminars in medical school. But he has a book, and it's super approachable. So look that up. Ideas for rebuilding my gut microbiome. Loaded question. Probiotics and prebiotics, best ones. So if you have to rebuild your microbiome, you can do this with supplements or you can do this with foods. You can do fermented foods, whether it's krauts, kimchi, just check the ingredient list to make sure there's no MSG. But you can do that with, lacto-fermented pickles. You can do 24-hour yogurt. You can do, just regular yogurt that you buy at the store. You can do prebiotic-rich foods that have things like inulin in them, pectin, all of the veggies. But if you are giving probiotics and you're trying to rebuild your gut from, say, maybe this person had taken antibiotics. I don't know their direct situation. But when we're rebuilding the microbiome, it's generally a good idea to put in some probiotics while also feeding the bacteria as well. So if you are eating a fiber-rich diet, which typically is vegetables, then we know that you're going to get all of the prebiotics that you need, which is great. But then when we put in some probiotics, they're going to actually have some food to grow and do their job. There's lots of different types of probiotics out there. You can get spore form, you can get regular form. There's different strains. There's Saccharomyces boulardii. You can drink kombucha. I forgot about that one. But you can do this with diet. You don't have to take a supplement, though a supplement will get you there faster. I can't really recommend a specific probiotic for this person because I don't know them, but I like the brands Orthobiotic. I like Megaspore. Some of the it's carried at like Whole Foods or something. It's got like a yellow label. I forget. But they have some really good multi-billion strain formulas. Jarrow has some good formulas. Renew Life, I think it is. But the key is dose. If you're taking a probiotic that has like 20 billion or less, then sometimes that's not enough because we have trillions of bacteria in here, you guys. So when you're putting in less than 20 billion, it's kind of like you're putting a drop in the ocean. So generally we need to be more robust on dose in general. So if I can and people can afford it, I try to get them up to 100 billion if we're rebuilding. Sometimes I have people go up even upwards of 200 billion when we are rebuilding. And it's a general good rule of thumb to rotate your probiotics. Don't just take the same one every time. For those of you that are just joining, we're doing a Q&A night. So if you have any questions, chime them in. I'm answering some ones that have already been submitted. Let's see. Best way to test your child and self, or I guess anybody, for mold toxicity. Most reliable test. So, I could do a whole night on mold, and I have done that in the past. There's different ways to test for mold in the body and also outside of the body. You can test your environment with an ERMI test, which I think is a great place to start because they're relatively inexpensive compared to some of these other tests that you will do to check yourself for mold. And you can buy ERMI test kits online and mail them in. It's pretty simple. And that will actually see what the spores are like of mold in your space. And it will quantify it, so it'll tell you how much there is a problem, which is awesome. I tend to favor the urine mycotoxin tests, which are looking for mold mycotoxins. And mold mycotoxins are essentially mold farts, which is a term I got from Jill Krista. And if you guys don't know Jill Krista, definitely look her up because she is the mold queen. She's an ND like myself. But mycotoxins are the gas that mold will create when it's growing. And mold colonies often like to compete for space, kind of like, you compete for the blanket in the bed at night, whatever example works there. But my husband and I do that. We compete for the blanket at night. But mycotoxins are these really tiny particles, and they are very easily, they're like microns thick, and a micron is really small. Because a cell is like 5 to 6 microns, like diameter. So these mycotoxins are really, really small, and they really easily get into our system through our lung tissue. Unlike mold fragments or spores that we breathe in, those are much bigger. Those can't really get as deep into our body as mold mycotoxins. And mycotoxins don't have a smell. They don't smell moldy or mildewy. We often can't even know that they're happening. But for people that are mold sensitive, they often suddenly get to have mold-like symptoms, upper respiratory symptoms, allergy symptoms, neurological symptoms. Mold can affect almost every pathway in the body. And so you can also test for mold with looking at an IgE allergy test to different types of mold, but that just shows us if you have made antibodies against mold. That doesn't necessarily tell us if you're being actively exposed to mold mycotoxins. So I recommend mold mycotoxin testing. There's a variety of companies that offer this. I usually use Vibrant. Great Plains Labs is really awesome, and they've kind of had the market for the longest time for their testing. But I pick Vibrant just because they have a couple more mycotoxins on there that Great Plains Labs doesn't. But both are great. All mold testing is in the 200 to 300 range per person. So that's what I would do to check for mold. Let's see. Do you recommend Acacia root for a prebiotic? If so, which one? So Acacia root powder is often used as a fiber because it's soluble fiber, and it's actually really good for people that have IBS or have IBS-like tendencies. because it's really, really well tolerated. So for some people that would benefit from a fiber supplement, or we need to get things moving, there's lots of different reasons to put people on fiber. And I don't put as many people on fiber as I used to when I first started practicing, because usually we can figure out something else that works a little bit better. But I like it because it is very, there's a weird squirrel up there in the tree. I like it because it's very gentle, and most people will tolerate it whether they have diarrhea or constipation. And it doesn't typically like stop people up like crazy. So it's gentle. But for prebiotic, I just recommend inulin containing foods, which you can find anywhere. It's things like artichoke and agave syrup and lots of different types of vegetables, burdock root. But inulin feeds a lot of the different types of bacteria. And so it ends up being really, really helpful, but really vegetables for prebiotic versus a fiber. But you can do fiber. Another question, can your B vitamin levels, any of them, be too high? And the answer to that is yes. And we can test for that in the blood, though not all of the B vitamin markers in the blood really tell us the whole picture. But that's often where practitioners will start, is just run, your B6 level or your B12 level or your B2 level, something like that. But generally, the way that we get alerted to if B vitamin levels are too high is with symptoms. So sometimes you can get neurological symptoms from having too high B vitamins. And so, if a doctor or a practitioner suspects this, then generally we ask some questions to see, maybe you're taking, let's pick on B6, for example, because this is a common one. Let's say you're taking B6 because your naturopath recommended it for your periods, and you also have an electrolyte powder with it, and it's also in your vitamin water, and it's also in your multivitamin powder, and it's also in your protein powder, and it's in your pre-workout. Those types of things can add up over time, and so I would just be cautious with that. But generally, it's symptoms. Let's see. Anybody else want to throw in a question? Otherwise, I'm going to keep working off this list I have. Let's see. Some of these are too specific for people. Yeah. What is your favorite type of collagen? Here, that's a good one. So, collagen is, of course, really necessary for having really healthy hair, skin, nails. There's lots of great collagen companies around, so I don't necessarily have a preference because a lot of them are excellent. I always look for a grass-fed collagen though, because we know that the animals that collagen comes from, had a good life, and so the collagen is going to be higher quality. So I always look for a grass-fed collagen. There's different kinds of collagen. I used to use a product that had a combo of marine and egg, inner egg membrane, plus like typical beef collagen, and that was really nice. But I tend to like collagens that will dissolve really easily and tasteless in things, because I like to mix it with stuff. I'm just like you guys, I have my schedule, I gotta mix things and go. So, I often use Vital Proteins because it is grass-fed and it's at Costco, and it's actually a pretty good price there. But I've used other companies, like Perfect Collagen by Pure Prescriptions. I do really like that one. And Bubs Collagen is a veteran-owned company that's local to San Diego, and so I've been a fan of them for a while. But really just get the highest quality, cleanest one that you can find. And one thing that you can also look for is the product tested for heavy metals and other problematic things like toxins, bacteria, because if it's not, then you could be ingesting those things. And that tends to be a problem in the powder world in general, is that, the products can be adulterated with different things, especially if the company is not doing good quality testing. And I'm completely unwilling to put that kind of stuff in my body. So I'm always looking at the people that are doing those types of testing. Hi everyone. We're doing a Q&A tonight. So for those of you that just joined, if you have any questions, hit me with them, because we're going to be signing off soon because we're almost done with all of our questions. But yeah, we're talking about collagen, and I don't really have a preference. There's lots of good brands. But I tend to use Vital Proteins just because it's convenient. But whatever works and is clean, and that can be different for everybody. Let me talk about, I have a question about thoughts on getting rid of gallstones. And this is a fairly loaded question because gallstones can build up because of an excess of cholesterol. And sometimes people just don't move their bile very well. And so we don't get good turnover, and gallstones can form. If you have gallstones, generally they're in there forever. There's a lot of info about the Gallstone Cleanses that you can do where you chug, lemon water and a crazy amount of olive oil. The problem with all those types of cleanses is that if you dislodge a gallstone and the gallstone is obstructing the out tract of bile, you are going to get very sick very fast. And so most gallstones will just chill out in the gallbladder. And unless you're symptomatic, we leave them in there. And, I don't do anything specific to get rid of these. This isn't totally my specialty. But a lot of people struggle with bile flow and digestion. And so often I will help, any sort of spasmodic, painful gallbladders to calm down with herbals. Or I will help improve people's cholesterol profiles and the fats that they're eating in their diet to help so that we're not forming a bunch of new ones. But definitely talk to your doctor about the whole getting rid of gallstones thing, because that can be dangerous. And usually if you have enough in there that it's causing you problems and pain, you're getting gallstone attacks, then they're just going to take out your gallbladder, which causes a whole other host of issues. But if you're in pain because of it, then it's much better to take it out. So I'm through most of my questions. If any of you guys that are on have any, throw them out. Otherwise, I'm going to sign off for tonight. And next week we are going to do another live. Here we go. Now you guys are speaking up. Okay. Thoughts on colostrum? Anything specific you want to know? Thoughts on running food sensitivity tests? So I like food sensitivity tests, though a lot of people don't and are vehemently against them. Every test has a purpose. And what I mean by that is, you should run a test if you think it's going to help somebody or it's going to change the clinical way that you're going to go about somebody's case. So when we look at a food sensitivity test, we're really looking at the immune system's opinion of a food. And the immune system's opinion of a food changes based on how much that person is eating that food, but also on that person's gut health. And so sometimes the results that we get from food allergy testing, like IgG and IgA, it's all dependent on some of those lifestyle things. Especially if somebody has a really leaky gut, sometimes the results are thrown off because their gut barrier is so inflamed and open that they're reacting to every single food. So when we're running and interpreting these tests, we just can't take it as gospel. We can't just be like, oh my gosh, you for sure have this horrible food sensitivity to coffee. But the person feels fine on coffee and has no issues. Like, there's just so many things to consider when you're running a food allergy test or food sensitivity test. But I do them in practice fairly frequently, and there's lots of different companies that are good. I use a company called Allotest just because that's who I run, and that's just what has gotten me good results with clients. There's lots of other good companies, and there's all sorts of types of different technology, which will affect the kind of results that you get, because you can run, an IgG test at this lab, and this lab, and get a slightly different result depending on what their assay was like and what their reagents were like, and if they used FDA standardized allergens or not. So all of these things you should consider when you're running these tests on people, or when you're getting this test run yourself. So I really like them because they help us narrow down some problematic foods. And if we can narrow down some possible problematic foods and do like a mini elimination diet for people and help them to feel better, then that's awesome, because if you do a full-on elimination challenge diet, that can take some time. And I know that at least a lot of people that I work with, they've been messing with their diets for so long, they want a little bit more direction. And even if that direction isn't perfect, it's still useful information for them. So I do end up running testing. And I also have crazy stories of, like I run a food allergy test, food sensitivity test on somebody, and like their psoriasis goes away, or their eczema goes away. That's actually really common. Or acne improves, or their digestive function improves. So I see the benefits of doing that, though depending on who you talk to, you might get a little shot down. Not all naturopaths are pro food sensitivity testing, and some of them for good reason, for sure. Is a colostrum, circling back to the colostrum question, is a colostrum supplement good for the gut? If so, what might you recommend? I use colostrum with patients, but generally I use a different type of product called an IgG immunoglobulin support supplement. And the reason why is because I have a lot of patients that can't tolerate dairy, and colostrum is a really, really nutrient-rich gut rebuilding thing to take, but it is dairy. And so for all my clients that really don't do well with dairy, I'm not going to give them something that's a dairy-based supplement. So I tend to do the IgG powders, the immunoglobulin powders. I really like SBI Protect by Orthomolecular. That's served my patients really well, and it's pretty tasteless, and you put it in a smoothie and you just kind of, blend and go. But some people want to go the traditional route and do colostrum, which is fine. Though because most of my patients have dairy issues, I just don't really go there first. So I'm not really as familiar with brands for that one as I am like other gut rebuilding supplements. Any other questions? Let me make sure I didn't miss anything, because I'm going to sign off once they stop coming. Thanks everybody for hanging out. We're doing Q&A for those of you that are just joining. So ask me anything. We talked about water. We talked about B vitamins. Nobody's asked any hormone questions. We talked about the blood type diet. Anything you want to know about health? For those of you that have been watching me for a long time, you probably want to pick my brain about different things. We talked about mineral water, toxins. Oh, I'm glad you thought it was helpful. Awesome. What about toxins do you want to know? Fun fact, speaking of toxins, I am releasing a detox course very soon, which is going to talk about some of that in terms of how you actually get rid of toxins and detox safely, effectively, scientifically, individualized for you. So we're going to talk about how you do that with supplements. We're going to talk about how you do that with food. We're going to talk about how you do that with sauna therapy. We're going to talk about just different sources of toxins and what to be aware of. And we're going to, go through a little bit of like why detox is so important and why, especially as a woman, we need to have this on our radar because, whatever we have going on with our bodies, it's going to be what we pass on to our children, and what we share with our family. And so it's really important for us women, especially for our hormones, to have good detox pathways going. But most people in America need to detox at some point. We are a very toxic world with all of the, new chemicals that come into circulation every year, with the fact that we don't move our bodies enough, with the fact that most people don't sweat every day, and that's a great way to release toxins. Plus, a lot of us, our food supply is just really not great. So, how about switching off meds to natural supplements? That's kind of broad. You can switch off meds to natural supplements, but you have to do it safely and under medical supervision for sure. Best red light therapy, best bang for the bucks. So there's so many good ones. Again, you really just have to read reviews and pick because there's different size of red lights. There's different kinds. You can do the infrared sauna type of therapy. You can do big red lights that you sit in front of. I've seen people have smaller ones. They hold up to their thyroid. I have seen people with red light therapy wear the caps to help regenerate hair growth. So really depends what you're using the red light therapy for, dictates what kind of red light therapy device that you buy. Love any tips for postpartum and breastfeeding, not necessarily Q&A, but for future live. Yeah. So postpartum and breastfeeding. I could do a whole live about that. You are totally right. But definitely one thing that I will say about that is you definitely get the baby's tongue assessed. Get the baby's tongue assessed and get the baby's tongue assessed by multiple different types of providers that look at tongue tie, because I can't tell you how many times that I hear about women later learning that their child had a tongue tie or had some degree of restricted tongue movement that affected the latch, that affected, how their whole upper palate grew and developed. So, and there's a lot of practitioners out there that I feel like they say that they talk about tongue tie and they assess for it, but they don't do it fully, because I hear a lot of stories about, it affects everything. It affects how your whole nasal cavity grows, and how, whether you're going to be snoring or whether you're going to need braces, all the things. But I've just heard so many stories of women going to different practitioners, and then finally they either learn that their child doesn't need help in that area, or they find that their intuition about how things were going with breastfeeding was right, and that the child did have an issue that needed to be addressed, but it took them several providers. So, for all of you mamas out there, if you have an intuition about something and you're not getting listened to, or you're going to practitioners but doesn't quite seem like a right fit, or something's just not, when you just don't feel it, I would definitely get a second opinion. I'm probably the biggest fan of a second opinion, because I was that patient that really needed a second opinion about everything, because I was learning about science and I was trying to heal myself. This was before naturopathic medical school. And I was just give me all the information and help me be the best that I can possibly be. So I asked a lot of people, questions, and you should totally do the same. So, but yes, I should totally do a whole postpartum breastfeeding type of live. That would be a really good thing. And if you're not hydrating yet, please hydrate, and lots of calories. Okay, you guys, we're getting close to the end of the time where Instagram's going to boot me off. So if any of you have some last burning things to ask, and some of these, you guys, that you're sending in are a little bit too specific. You know, I'm not your doctor, so I can't, answer some of these specific ones. And for you, Julie, who's asking, about getting off some of these meds, you can't just swap supplements for a medication. The thing that I would tell you, if you're on medications and you seem to need them, or you seem to do really good on certain medications, I would do some research about the mechanism of action behind that drug, because for most drugs, we know some about how they work. Some we have no idea. It's actually funny. Some drugs we give people, we have no idea how they work, but they work, so we give them to them anyways. But for the medications that we know how they work, I often like to think backwards. So, if we're giving you something that's affecting your mood, like an SSRI, and an SSRI is going to work on serotonin, and it's going to keep serotonin around in the synapse in between the nerves longer, so that you can use more of that serotonin and have more of that available to support you. If you do well on something like an SSRI and you want to get off of it eventually, which I highly recommend, then you have to think, okay, well, why am I not making really great serotonin? What's going on in my gut? What's going on with my genetic pathways that are, helping me make serotonin? I might have said melatonin a second ago. I meant serotonin. They're very similar in their pathways, so I get them confused sometimes, and they sound the same. But, when you're on a drug and we know how it works and you want to get off of it, think about what the mechanism of action is, and then think backwards. So think, okay, well, if this is helping me make more GABA, why am I not making a lot of GABA? What's stealing that away? What's affecting that pathway? And you have to kind of get nerdy. And your naturopathic doctor or your functional medicine provider in your area can help you with this. Though I'm kind of unique in this think backwards approach. This is something I've just made up and found helpful with patients is, when we give someone something and they feel better on it, think, why did they feel better on it? What was the mechanism biochemically that it was supporting? And then sometimes we can work backwards, or oftentimes we can work backwards and, help people come off of things. So I work with a lot of women who are anxious and or depressed. And so, especially for the women where they take Xanax and, totally changes their world, I think about, what's going on with your GABA pathway, because it's clearly struggling. Or again, with the SSRI, what's happening with your serotonin pathway? It's struggling, why? And, you have to go back to the reason why you were put on certain medications in the first place. Because sometimes people were put on medications, that should have been used for a short period of time after surgery, or, for an adjustment phase, where they weren't supposed to be used long term. And so think about, why did I get on this drug in the first place? Is it really helping me? Do I need it? What do I need to be concerned about if I get off of it? What natural things can support me? What pathway is this drug going through? Is there anything natural that can support me? What diet lifestyle interventions can do that can help me? And some of this stuff is really easily researchable, but whenever you're changing medications and getting on and off different supplements, you gotta be under the care of a doctor that knows what they're doing. So definitely don't taper yourself off your meds by yourself. But I'm going to get kicked off here by Instagram at any moment. And it was really great hanging out with you guys. And I got to a lot of questions, so I hope this was helpful. And I know a couple of you guys that submitted the questions beforehand were in here, so that was great. But I hope you guys have a great night. We're going to do another one of these in about 4 weeks. And, we'll just keep the conversation going. For those of you that are new to me, my name is Dr. Megan Branning, and I am a naturopathic doctor, and I do these Monday night live things, Instagram lives at 5. And then if you miss them, I post them to my YouTube. So if for some reason you can't make it at Mondays at 5 Pacific, then, you know, they'll be up. But I always appreciate when you guys can come live and interact with me. It's super fun, helps make my job easier, and I like connecting with you all. So I will see you guys on another Monday night. Let's see, what are we doing next week? We are doing everything about hormone testing next week. So I'm going to talk about my unique approach to how I work up hormonal issues, especially with women, and the type of testing that I do and all the treatment considerations that I will think about when I'm going through a case. So ladies, tell your friends and bring your friends, and we're going to talk about it next week. And we're going to have a lot of fun because this is probably one of my most favorite topics, and we really need to keep talking about this topic because nobody talks about this topic, and it's ridiculous because all of you guys are out here saying, what the heck is going on with my hormones? And, you know, you're struggling. And so I want to take some of that struggle away by educating you on what to talk to your doctor about and stuff like that. And Julie, I think you're asking me about how do I find one, as in how do I find a doctor that's going to listen to me? Send me a DM and I'll give you some resources, because there are definitely some really easy ways to search online for a good doctor. But overall, do an intro call with one of your doctors that you're considering in your area and just talk to them and see how they approach things and see if you like them, see if you like their approach. I do intro calls with people all the time, and, you know, if they like me, they book with me, and if I'm not their jam, then they go to somewhere else, or, you know, if they're not the right fit for my practice, then I try to refer them out to somebody that will help them. So it's all about finding the right fit and someone that's going to help you with whatever stage you're in. So good luck with that, but DM me, and I'm going to sign off, and I will see you guys all next week to talk about hormones.